This programme is specially developed for general practice nurses to help them develop their personal contribution, their voice in shaping health and care services locally, to help with their career development so they can really be part of redesigning our health and care system as we seek to improve the health of the population and the professional experience of the staff delivering that care and support. The COVID-19 pandemic has presented some particular challenges, and they've encompassed physical health, mental health, but also wider health and well-being needs, whether it's being socially isolated or unable to go shopping. This programme is designed to improve the resilience of nurses individually, to help increase their capability to be able to get involved and shape services so that we really make a difference for patients and for general practice nurses. There are three key elements to the programme that we recognise are probably equally important if we're going to enable general practice nurses to play their role in both shaping and delivering new ways of care. The first is recognising that we need to ensure that each of us is personally resilient to be able to support others, both in the short term and in the long term. It's a bit like if you're unfortunate enough to be in an aeroplane where the cabin decompresses and the oxygen masks drop from the ceiling. It's really important, we're instructed indeed, to put our mask on first to ensure that we have that supply of oxygen before we help others. It's crucial that we're looking after ourselves, that we're providing general practice nurses with support for their own personal resilience, so they are in a place that they can help others. The second thing is recognising that we all need to adopt a more proactive, personalised approach to how we care and support, or essentially increase the capacity for our communities to look after themselves. This sense of a population health management approach where we understand the health and well-being needs of our communities more deeply. We can now understand, well, what sort of care and support would we need to put in place that would better meet those needs? What are the skills that are required from the workforce to develop just that sort of offer? And then we start to understand, how do we as individuals contribute to that? It's less about a role we might have held. It's more about the skills we have and how we develop them and tune them to the needs of the population. Experience around the country shows that this is improving both population health and well-being, but also the joy and the meaning that professionals find being at work. The third thing is, if we are going to work together, we need to make sure that's really effective. There's no point being in a team that isn't actually functioning as a real team. And in order to do that, we need to make sure we've got a real sense of common purpose, that we really are having to work together to enable us to do that. And we're spending time evaluating what we're doing and how we might improve it. This is all part of, I guess, the resilience, the understanding, the ways of working that the programme is promoting to help improve the health of the population and the professional experience of general practice nurses. The Shiny Minds app has been co-designed with the NHS to provide just that sort of support, both individually in terms of understanding emotions and resilience and how we can take the time to protect ourselves and our own health so that we can support others, but also in terms of connecting people so that they can share at an emotional level, but also some of the practical problems and solutions that they're all coming up with. So that hopefully by creating this sense of community, working together, we can not only support nurses and their individual resilience and their individual needs, but also how they as a group can support each other and effectively shape future health services and support individuals within the population more effectively than ever.